right, guys, we got Bree in here. Bree's our social media girl that helps out with all of our YouTube videos, our postings online. Bree is 26 weeks pregnant. She gets adjusted when she's down here once every month, 2 months. We've seen her just a couple times over the past year with COVID, but now she's growing a beautiful little girl. Mm-hmm. It's 26 weeks, right?
Yep.
How's pregnancy felt?
Good. I feel pretty good.
Pretty good?
Just a little low back pain, but it's kind of expected.
Yeah. And we've worked previously on right side neck. She gets a little irritated. Yeah. We'll say a little congested up in the cervical spine, a little bit of tension over here on the right side we're feeling. And so you guys will see Bree with chiropractic care on video. We're going to adjust all 3 areas, neck, mid, back, low back, probably do some sacral work, some leg stretching, help to reduce some tension throughout her spine. And, we're starting up in the neck, and we just start to notice that the right side scalene's a little tighter right through here than the left side, but there is also a little pressure on the left side as well. So we're going to work up into the suboccipital region first. As we do with other patients, we're going to start with the little back hypervolt treatment to the upper trapezius. Is totally safe throughout pregnancy. A lot of the times people will come in here and they say, can I do this during pregnancy? Is exercise safe? Is chiropractic care safe? Yes to all the above, as long as we work gently with what the patient feels comfortable with, or the person that we're working on feels comfortable with. We'll use the hypervolt up on her neck today and a little bit down into her hips. And we're going to do a little muscle work up in her neck, a little myofascial release down into her lower back. We'll get her cervical spine, thoracic spine, lumbar spine, and pelvis adjusted. We'll check out some of the extremities, the feet, the knees, the ankles, and elbows and shoulders for her. So you've seen her on a couple of the videos in the past. She typically adjusts really awesome. One of the things that happens through pregnancy, we develop a little more forward weight in the belly, causing a lot of strain and tension in the low back. So she knows a couple of the exercises that we want her to practice at home to help relieve pregnancy-related low back pain, hip pain, and if it does get bad, we can develop sciatica, piriformis syndrome, and really just some radiation of pain down into the leg or both legs. So it is important throughout pregnancy that we maintain, adequate levels of activity throughout the day. We stretch a little bit. We help to align the pelvis through leg exercises, feet exercises, and really just strong, balanced posture. Some of the benefits of chiropractic care throughout pregnancy: reduced pain, improvement in circulation systemically. So a lot of times we'll see some women will have one leg or one ankle that swells a little bit, as well as increase varicose or spider veins, which can sometimes develop due to pelvic imbalance, muscle imbalance down in the lower body, as well as just the way that we stand throughout the ever-changing body. That as we grow that baby, there is a lot of stress throughout the joints, primarily down in the lower extremity, but also can happen up into the neck and the upper back. So posture is important. A little bit of daily exercise is important. And as we recommend all of our patients, if you get pregnant, it's a perfect time to start or continue with chiropractic care to help alleviate some of the side effects, such as low back pain, hip pain, or leg, ankle swelling. And pull the head over to the right for me. All right. And let's look straight forward. We're going to start on the right side neck because that's the tighter side. Look down for me. And then just hold right down there for me.
Yeah, it's definitely tender.
You feel that spot?
Yeah.
Have you had any headaches this past month?
Yeah.
A little bit?
Mm-hmm.
When do you notice the headaches come on?
Later in the night. Typically. Around dinner time.
And Bree has kind of a mixed job of photography, videography, and a lot of computer editing, right?
Mm-hmm.
A lot of picture.
Yeah.
So definitely good postural habits throughout the day and throughout the week are important. She has kind of chronically had a little bit more right side neck strain as we've adjusted her. I felt her neck much worse in the past, where she gets kind of twisted up on the right side. She can feel some of this tender spot, some of the tender spots around the cervical vertebrae right through here, and a little myofascial release to the suboccipitals and to the upper cervical musculature helps to promote circulation up into the spinal cord, up into the brain. It reduces tension up in the neck and will help to ward off some of the cervicogenic or the neck-related headaches. Look up and down.
I've been trying to have a standing desk, so I've just been like, I'll stand, sit, like all day. Just mix it up.
Transition.
Yeah.
And then you're working on some of the, the foot exercises, balanced posture through the feet.
Yep.
Nice weight, a little bit of weight transfer or weight shifting left and right through the left foot and the right foot.
And a lot of the, I'll put my toes like down on the ground just to stretch them.
Stretch the ankle and stretch the toes. Awesome. Look down and look up and look down and look up and look down and look up and look down and look up, look down and look up and look down and look up and down. That's your bad guy right there. Ooh. It's the good pain though, right?
Yeah. Yeah.
So there's good pain and there's bad pain. We talked about this on one of the videos in the past about when we pinpoint where the irritation is at, the sprain of the neck or the deficiency in the movement of the vertebrae. Look down for me. And so when we kind of hone in on the 1 or 2 or maybe 3 joint segments, look down for me. We can really feel like that's like the epicenter or the center. Hurricanes have like eyes, right? So there's like the eye of the hurricane. And injuries have an origination spot and then multiple compensation spots. And so one little twisted vertebrae or shoulder bone or elbow bone can create tension the whole way up through the body, and then ultimately we can develop subsequent injuries, whether it's a low back on the left and a right knee and a left foot. Maybe we have left foot plantar fasciitis, right knee pain, left low back pain. All of those compensatory or compensations are linked back to the primary area of dysfunction or the primary area of injury, which is ultimately our goal, is to reduce all the compensations and address the primary area. And look up, look down, 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 look up, look down. Good. Okay, stand up tall for me. All right, guys, so one of the things we have here in the office is a pregnancy table. This is called a thoracic breakaway. So this allows all of our pregnant patients to comfortably put their belly down in here as she's gonna lay face down for us. It's a really good rest for a client or a patient to be able to just kind of, comfortably, which that feels pretty good, right? Comfortably lie on her stomach and just allow the body to kind of stretch out in this position. And what we do first, we check the heels and we feel that her right foot is a little easier than her left foot. Can you feel this movement here? And this left side's a little tighter, right?
Yeah.
No pain though?
No.
Just a little tension? All right. And so I like to just kind of, there goes an ankle adjustment already on the right. I like to just kind of weight the heels down right here and just get a nice internal rotation stretch up the leg. She might feel a little tension in the back of the knee, maybe a little tension in the calf, maybe a little tension on the inside of the knee, or maybe possibly even up into the hip. And definitely this left side is a little stiffer, so we are going to do a little more foot mobilization on the left side. All right, but let's start up in the low back. We're gonna raise this up, and we're gonna roll these down one, okay? Now when we have a growing baby, the baby does shift our center of gravity, our center of mass a little bit more forward. So a lot of times we'll start to see people develop a little bit of this tilt as the baby grows. And sometimes if we start favoring a leg, left or right, that's where we start to get that left side or right side low back, as well as hip pain. And Bree has just a little bit more tightness, a little bit more imbalance over on the left side. Does that feel okay?
Yeah, feels good.
All right, you tell me at any point if it's a little too much. You feel those ribs right up here a little bit? Is that sore right through there a little bit?
Yeah, it's a bit sore. Like, I mean, it's tender, but yeah.
Feel that little knot right there? Or that little trigger point or little muscle irritation right through there. So we'll definitely focus on getting the right side rib cage to loosen up a little bit. There goes an adjustment in the rib right there. So we just had a little pop out of our low back, just with some of the muscle work. So if you ever gotten massages and never been to a chiropractor, sometimes the massage therapist, just by applying pressure through the body, we may get some joints to loosen up. But really with the chiropractic adjustments, we want to kind of hone in and focus in on getting those spinal segments and getting the rib segments, all the joints to undergo and develop better adjustments, better cavitations, to ultimately help stimulate the neurological system and the muscular system to balance out a little better. Good. Back down. Bend this up here. And Bree does a lot of at-home stretches and exercises that we recommended so you guys can see how easy her foot kind of gets up to her glute a little bit. Go ahead, push into my hand for me. And then just stop. And push. And stop. And push. And stop. Awesome. Sometimes I'll work into some toe flexion adjustments there. And there's a knee adjustment right now. All right, push and stop and push and stop. And just by stretching and feeling how well patients move, we can kind of assume that Bree is not going to really have too bad or too difficult of a pregnancy because she is super flexible already down into her legs and her hips. Push and stop. And push and stop. And we can tell that by how much knee flexion we're getting down here. All right, little toes. Good. Good. Do the other ones face it up. Okay. All right. Good work, good work, good work. So, we talked about the left ankle internally rotating a little less than the left. And what we're going to do, which again is totally safe for pregnancy, a little bit of hypervolt around the hip crest where we get some tendonitis or muscle tension, muscle tightness around the pelvis. Now this is great for pregnancy patients because it can really help provide relief for SI joint pain, low back pain, hip tightness, hip tension. It helps to stimulate the pelvic floor, the pelvis, the SI joints, and it helps to create good circulation, good blood flow down into the hips. It'll help make our adjustment a little easier. And ultimately allow her to have some low back pain relief over the next month. Now, have you been getting adjusted up at home at all?
Just one time, because I had a really bad migraine. But that was probably one time within the last few months.
Did you used to have like more chronic migraines headaches, right?
Yeah.
I remember when we first started working together, like that right side neck was super jammed up, right?
Yeah, I don't get them quite as often now. Yeah, my neck feels really good.
Did you feel really good?
Yeah.
Awesome. All right, good work. Right there. Right here, one more here. Good. Okay. There it is. That left ankle just clicked a little bit too.
I think this
Okay.
is gonna adjust too.
Yeah, we'll do that one face up. Let's take deep inhale. Exhale out, all the way down. Good. One more breath in. Exhale out for me. All the way down. Good. Breath in and exhale out. All right, good work, girl. Let's do a little rib stretch. Take breath in through your nose. Exhale out. One more breath in and exhale out. Way out. Good. Breath in and exhale out. All right, now we're going to switch sides. We're going to grab right here, pull just gently, deep inhale through your nose. Exhale out for me. And one more in through your nose and out through your nose. And one more in and out. And what we're doing is just a little decompression, a little stretch for the low back to help the lumbar vertebrae just kind of rotate gently through the lower body. Okay, let's roll to your left side up, right side down. I'll pick this back up. Now, one of the things that we do change, one of the things that we just kind of, we don't go super aggressively with the low back adjustments, but we do try to get a little bit of release. I'm going to pull this out here and here. Out of the low back, breath in, exhale out. All right, good work. Other side, there's a little release. And so I will do side posture adjustments up until, week 34, 35, 36. Everybody grows a little differently. Breath in, exhale out. Good, one more. Good. All right, flatten your back for me. And that little bit of movement in the low back really helps to reduce pressure in the spinal column. It helps to loosen the muscles up throughout the lower body. A lot of new clients that come in during their first, second, or third pregnancy say, why the heck didn't I do this sooner, right? When you're undergoing pregnancy, you can develop, obviously we talked a little bit about low back pain, hip pain, sciatica. Much easier to get those areas worked out prior to pregnancy as opposed to like week 30 or 32. So great natural alternative healthcare is starting, part of any healthy pregnancy plan. Raising a healthy baby should include chiropractic care to the low back, as well as exercises to help strengthen the pelvic floor, balance out the pelvis, the legs, the low back, and just get a better structure down through the columns, down through the legs, up into the body to help reduce any kind of irritation throughout, okay? So, one thing we do want Bree to work on, touch your feet together. We want to work on what we call double foot squeeze or double foot press. And what Bree's going to do is, you guys see how she puts her feet in this beautiful down and in position. We show this on a number of videos. If we see her kneecaps, you can see how her left kneecap turns out a little more than the right side, okay? So we're gonna work on teaching Bree how to stimulate some of the right leg, right hip muscles Bree, what you're going to do, you're going to squeeze your heels gently together and a little bit of pressure through your legs or a little bit of pressure through the front of your foot. Do you feel how that kind of engages a little bit of the leg muscles up on the inner side?
Yeah.
Now, if I say gently twist your left knee out, see how that left leg feels, and then gently twist the right knee out. Do you notice how the right side's a little tougher?
Yeah, it doesn't quite move as easy.
It doesn't quite move as easy. So she does have a little bit of pelvic misalignment that we need to work on with some appointments. But at home, she's going to work on balancing her legs out by laying in bed or laying flat on the floor, squeezing through the feet, gently twist the left knee open, and just kind of hold there for 5 to 10. And then let's gently focus on the right knee open. And feel how the front right hip and maybe even up into the side of the hip. Yeah. Do you feel that strain up there? So this is a really great, easy rehab exercise to help Bree develop a more balanced pelvis as well as balanced muscles throughout the pelvis. Try to straighten this right knee a little bit. So kind of lock it out, but twist it open. And now straighten it, good right there. And now hold right there. Now left knee a little straighter. Feel how that leg's way easier. And now right leg a little straighter, right knee out a little bit. And kind of find that external rotation spot and feel how that right side's a little different than the left side. Keep squeezing the feet together. Straighten your right knee a little bit. Twist your right knee open a little bit, good. See how there's a little quiver, a little shake right there. Left knee straighter. Good, right knee straighter. All right, work. So at home, I want you to just work a little bit flat on your back on double foot presses where we squeeze the feet together. All right, and then we're gonna do ankles. And good, and left ankle. All right. Left knee, hand up. Nice and gentle right here, good. Good. And then we'll see this right knee bend up here. Okay. And now double foot press again. And straighten the right knee back, good. Right there, perfect. Feel how that right leg feels. Twist the right knee open a little bit. And just kind of hold and work on that leg extension with a little bit of external rotation for me, okay? So this will be something you're going to do at home, about 5 minutes, working on the right hip, the right leg, okay? All right, up into the arms. And then elbow. Little stiff. And throughout life, guys, we want to keep the joints loose. We want to keep the skeleton loose. We don't want arthritis to develop. And we ward off arthritis with daily exercise. Easy here. All right. Daily exercise, daily stretching. The fingers, a lot of people are concerned sometimes about developing arthritis from adjustments or from over cracking your knuckles. You might have heard, not a bad thing. You don't want to overdo it to the point where you can create ligament laxity or too much stretched ligaments. But it is good to do a couple times a day just to release pressure down into the different joints throughout the hands, the fingers. Easy here. Easy here. All right. One more there. All right. And you guys will see us pull the head long, and then we point the feet long. We want to be as tall as we can, as we say here in the office, from our toes up to our nose. We want everything to get nice and stretched out. Bree's going to work on some foot squeezes down, some foot presses in. And those are the big things for the lower body. You are healthy, healthy, healthy woman. All right, let's roll to your right. And you'll sit on top. Okay. All right, and there you go. Bree's 26 weeks pregnant. We'll see her probably, I don't know, she lives a little bit far away, so maybe 2-3 more times. 2 more times probably before baby's delivered. But if you keep down this path of body balance through the neck, through the shoulders, and especially through the low back and the hips, she should have a pain-free, healthy pregnancy. Good work, girl. All right, there we go. We'll see you guys on future videos. Great adjustments.
Thank you.